Let's talk about cardiac arrest. Is the abrupt loss of heart function in a person who may or may not have been diagnosed with heart disease. It also known as cardiopulmonary arrest, circulatory arrest, or sudden cardiac death. Our heart is a vital organ that pumps blood to all parts of our body. Here in cardiac arrest, heart suddenly stops beating. Then what happens? When the heart stops beating, the blood cannot properly circulate around the body and the blood flow to the brain and other organs is decreased. And do you know, this is a life-threatening condition, can become fatal if you don't get immediate treatment. Also, keep in mind that do not misunderstand cardiac arrest with heart attack or MI, which is totally different. Myocardial infarction or heart attack is a circulation issue where the blockage or narrowing of the coronary arteries leads to reduced blood flow causing ischemia. Whereas cardiac arrest is an electrical issue in which heart suddenly stops beating due to problems with heart's conduction system. And remember, heart attack is one of the causes leading to cardiac arrest. Let's see the symptoms. Symptoms of sudden cardiac arrest are immediate and severe. It includes sudden collapse, no pulse, no breathing, and loss of consciousness. You might see persons suddenly collapse in hospital settings or outside, but in some cases, other symptoms occur before sudden cardiac arrest. We can call them as warning signs of cardiac arrest, which include chest discomfort or pain, nausea and vomiting, shortness of breath, weakness, and heart palpitations. But sudden cardiac arrest often occurs with no these warning signs. Next is the causes of cardiac arrest: coronary artery disease, heart attack, cardiomyopathy, heart valve diseases, then heart failure, congenital heart defect, abnormal heart rhythm like ventricular fibrillation, ventricular tachycardia, and long QT syndrome. And what is the long QT syndrome? It is a condition affecting repolarization of the heart after a heartbeat. Do you know the most common cause of cardiac arrest is ventricular fibrillation, also called VFib, which is a rapid heart rhythm causes ventricles to tremble instead of normal beating. Then other causes that not related with cardiac issues are trauma, respiratory conditions, and toxins. Also infectious diseases, which will lower oxygen levels and reduce the blood volume and affect the heart function. Next comes diagnostic measures. Cardiac arrest can happen to any individual at any time. It's not necessary that they have some cardiac issues. So, through diagnostic measures, we can just find out the causes leads to cardiac arrest. It includes blood tests like electrolytes, serum potassium, magnesium, calcium, and phosphate levels. Also, the levels of troponin and certain hormones. Next, chest X-ray and electrocardiogram (ECG). This is a quick and painless test which measures electrical activity of heart. Next, echocardiogram. Here we have to check for ejection fraction, which belongs to in a range of 50% to 70%. If the ejection fraction less than 40%, it increases risk of sudden cardiac arrest. Next, cardiac MRI, nuclear scan, which helps to see the changes in blood flow to the heart by a use of radioactive material given through a IV. Also, electrophysiology study. It uses small thin wire electrodes placed directly on the heart to evaluate abnormal heart rhythms, which will lead to cardiac arrest. As I said before, heart attack is one of the leading causes of cardiac arrest. So, through coronary angiogram, we can find out any blockage in the coronary arteries. One of the things we cannot do all these tests if a person in a cardiac arrest. So we can also consider these tests just like a preventive measures. Next is treatment. Cardiac arrest treatment has to start immediately wherever you are. If you see someone experiencing sudden cardiac arrest, first of all ensure scene safety. Then check for response by tapping his or her shoulder and shout for nearby help and activate emergency response system and get an AED. Assess breathing pulse. If no pulse and breathing or only gasping, then start CPR, cardiopulmonary resuscitation immediately. Make sure that administer high quality CPR rate of 100 to 120 pushes in a minute. Also allow complete chest recoil after each push. Check airway for any obstruction and no obstruction. Give rescue breath of 2 if someone arrives for help. Perform cycles of 30 compressions and 2 breaths and use an AED as soon as it's available. The ratio should be 30:2, 30 chest compression and 2 rescue breaths. Allow AED to rhythm check. Give shock if it is shockable rhythm. continue until a ALS provider takes over or victim starts to move. So far we said about the management if the person in a cardiac arrest outside of a healthcare facility. Let's see the advanced treatment for cardiac arrest patient in hospital. In hospital settings, the management involves chest compressions, rescue breath, and instead of AED, shock is given through defibrillators, which stops the abnormal electrical signals and restore normal impulses. Before it, you have to understand what is shockable rhythm and non-shockable rhythm. Ventricular fibrillation and pulseless ventricular tachycardia are the shockable rhythms. Non-shockable lethal rhythms are PEA, pulseless electrical activity, and asystole. Therefore, delivering shock or defibrillation to this rhythm are worthless. There is nothing to reset. Best treatment for this rhythm is continuous CPR, medication, and correct underlying cause. Next is oxygen therapy. Helps you get enough oxygen as your organs continue normal work. Then administration of IV medications like antiarrhythmic drugs to treat irregular heartbeats and manage symptoms. Also, injection epinephrine is the most commonly used medication in cardiac arrest. Then extracorporeal membrane oxygenation, ECMO. This is the therapy used to treat people with life-threatening heart and lung failure. By a machine, this adds oxygen and removes carbon dioxide from your blood before returning it in your body and stress of your heart and lungs to promote healing. Targeted temperature management. This is a treatment designed to lower the body temperature to help protect the brain and other organs. Here you can use cooling methods like cooling helmets, ice packs, or cooling blankets. Other medications that might be used to treat cardiac arrest are beta blockers, ACE inhibitors, and calcium channel blockers. If the heart returns to its function, you have to treat the other underlying causes through cardiac procedure and surgery. It involves coronary angioplasty with stenting. Here, a balloon tip catheter is inserted into coronary artery where the block is located. Rapid inflation and deflation push out the blockage and re-establish the blood flow. In addition to balloon treatment, healthcare provider places stent permanently to prevent the further blockage. Next is coronary artery bypass graft. This is a open heart surgery aims to bypass the narrowing coronary arteries by using arteries or veins which is harvested from other parts of the body and restore adequate blood flow. Then radiofrequency catheter ablation. Here, a catheter is inserting into the heart. It uses small burns or freezes heart cells to cause some scarring on the inside of heart. This helps to break up or insulate the electrical signals that cause irregular heartbeats. Implantable cardioverter defibrillator, which detects abnormal heart rhythm and provide low energy shock to restore normal heart rhythm. Corrective heart surgery. Surgery may be done to correct heart conditions present at birth or heart valve diseases or diseased heart muscle. Let's see the risk factors. Family history of cardiac diseases or cardiac arrest. Have it in your family. Diabetes mellitus, obesity, a previous episodes of sudden cardiac arrest, hypertension, high blood cholesterol levels, smoking, inactive lifestyle, a previous heart attack, drug usage, obstructive sleep apnea, chronic kidney diseases, low potassium or magnesium levels, older age, gender, especially males. What are the complications of cardiac arrest? Here in cardiac arrest, when heart stops beating, the blood flow to organs, mainly to brain, is decreased, resulting brain damage, and also most of the cardiac arrest leads to death. If this video really helps you, please comment below and like, share and subscribe my channel. Thanks for watching.